Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of the CheckUp. As the CDC reported a couple weeks ago, people with chronic conditions have been hit particularly hard by the COVID-19 pandemic. They were 6 times more likely to be hospitalized than people without an underlying chronic condition and 12 times more likely to die. So what's the lessons that the industry can take away from the pandemic when it comes to caring for this vulnerable population? I'm joined today by Nick Loporcaro. He's president and CEO of Landmark Health. The home healthcare company was founded in 2013 by Adam Bowler, who eventually went on to lead CMS's Innovation Center. Landmark operates in 14 states and cares for more than 100,000 seniors with chronic conditions. Nick, thanks for being with us today.
Thanks for having me, Matt.
So as I said at the outset there, COVID-19, we're seeing data from CMS and CDC about how hard hit patients, particularly seniors with chronic conditions are. Those are the patients you're caring for quite a bit. Tell me about some of the challenges you've seen in just that patient population, in your patient population.
It's interesting with Landmark. We're an in-home medical care. Think of us as a geriatric, mobile geriatric practice. So with the 100,000 patients we have in the 14 states and now close to 46 different cities, our patients have become accustomed to being serviced at home. So the part of keeping them at home, ironically, wasn't as big an issue. But then it came to isolation, right? And I've said this to several people. Think about what we refer to as our Joes and Josephines, our patients, already feeling isolated. They're home, and all they're listening to is media telling them that sort of this is the end of the world, and you can't see your grandkids, and you can't. So the behavioral health issues rose to the surface really quick for us. We took stock in that early on. Our chief behavioral health officer, who's I always tell people is employee number 8 on our list. So social determinants of health have been a part of our fabric since the beginning. So we got our arms around them right away. We switched to telephonic and virtual outreach from the get-go. Actually, we kicked off our efforts very proactively. At the end of February, I gathered some of our clinical leadership. We're very fortunate. We have an infectious disease specialist on our team. So along with my chief medical officer and my chief operating officer, I basically tasked them with giving us guidance on what it is we needed to do. From an office perspective, we went to remote working right out of the gates, and then started looking at, like I said, telephonic outreach as we were procuring our own PPE to be able to continue to get out to our patients. So to your question, the first thing we did was make sure that our Joes and Josephines weren't feeling even further isolated or more so than they already were.
Yeah, that isolation question is one that obviously was impacting seniors even before COVID-19. And, there have been tons of studies from ARP and elsewhere on the long-term impacts of isolation on these patients. So I imagine that having to address that with them during this pandemic has been even exponentially more important for you.
It has, and it's almost counterintuitive, right? I'd have people reach out to me and say, boy, this is the most vulnerable population. This is the population we fear the most, that COVID is going to impact, the most as well. And what's been interesting is our inbound call volume increased literally fourfold in the first few weeks, and people reaching out to us and with inquiries, and were we going to be able to take care of them because they feared, one, getting out of the house, even more so going to an emergency room or even to their doctor's offices. So, we have a team of data scientists as well, and we have our own analytics platforms. We do a lot of predictive analytics. We look at our patients from an acuity level, so those that are, require even more attention. We started running our algorithms right out of the gate and made sure that not only did we get our arms around them virtually, that we were out in front of them with, albeit limited PPE at the time. We were very thoughtful in prioritizing who we were getting out to. And as we could, reached out to the rest of those individuals, again, either telephonically or through video conferencing. We have our own proprietary video conferencing applications in the interim of building up our PPE. I can tell you today, we are in excess of 70% face-to-face visits again, back to the patients that need to have us in their home. So what's interesting when I say, allude to being counterintuitive, the way we take care of these patients and they being now accustomed to being serviced at home, we've been very instrumental in making sure they've stayed home, they've stayed safe, and they're not exposed. Our numbers, and at least what we've learned so far, are very small with respect to the number of our patients that have either had exposure or contracted COVID.
So it's interesting you say you're up to about 70% back face-to-face. I imagine, though, at the height of this, the past couple months, you were doing quite a bit of telehealth services, right? What did you see in terms of the growth there?
So our telehealth visits grew in excess of 250% from what we were doing. And it's interesting. A lot of people ask me about telehealth and telemedicine, and we've embraced it as a tool. So I'm always very careful when I say that. If you look at our patient population, 30 to 40% of them either have hearing impairments, visual impairments, cognitive impairments, don't have access to the right tools. And quite frankly, if you're having a COPD exacerbation event, we need to be there with you. So as we ramped up our PPE, and kudos to our team in getting really creative in sourcing that, and it's interesting, our providers actually wanted to get out to see their patients. And, they have their own concerns, right? As they're getting out there, they've got to come back to their own households. But it is impressive to see the desire to want to get out and, be with those patients because they do need us out there. So today we're in excess of 70% face-to-face. Initially, though, to your question, like I said, fourfold increase in inbound calls initially in the first few weeks. We went to telephonic right away just to make sure that they knew we were there. As we could establish the virtual contacts on video conferencing with the patients that could, we established that. And as I mentioned, we determined pretty quickly the patients that still needed us to get out there and have those physical visits.
Yeah, it's interesting because we hear a lot about, and we've written a lot about the benefits of telehealth and how it's grown exponentially during the crisis. But I guess we haven't really talked about those patients who either with hearing conditions or other conditions that maybe telehealth doesn't work for them and they still need that in-person visit.
Yeah, look, again, if you look closely at our patient population, our average patient is 79 years old, 8 chronic conditions. These are individuals that would often see themselves in an emergency room, in the hospital. And so they need that level of intervention. Now, has telehealth helped us? Enormously. Higher touch points, higher frequency. If you're on a lower acuity level and you're more stable, this allows us the opportunity to interface with you. And it's quite frankly expanded our reach. We've looked at and our model has been reliant on, back to that patient profile I mentioned earlier. Now what we've seen, and COVID really did put a spotlight and has driven a demand for people that would rather be taken care of at home, and probably a combination of that virtual visit on the quick check-in and then doing our visit. So it's really expanded the demand for what we do, even beyond the typical profile of individual we've been serving.
Right. I'm curious too, Nick, you've referenced the PPE situation a couple of times here. We're obviously seeing some spikes in some states that you work in. We've also heard concerns from primary care providers that, on the front end of this, PPE was going to the hospitals. There's a lot of attention there, but not so much for these physician practices that are beginning to reopen. How are you able to manage PPE? How are you able to get what you needed? And what are your concerns going forward as we, think about spikes in some other states?
Look, the quick answer is, and again, kudos to our team. Our sourcing team had to get really creative. We paid a premium for it. We had to do, like a lot of people, go beyond the regular channels. We talked to our distributors who were struggling because their priority was on their hospital customers. So we sourced enough to have an ample supply and keep us comfortable as we look at our projections. But we're not taking it for granted. We're continuing to make sure we have those supply lines and staying very sensitive to that. And as well, like I said, we're doing this by acuity level. We're making sure we're getting out to the right people first and foremost that require those physical visits. And one of the reasons we're at the levels we're at is our patient population continues to grow. As I mentioned, the demand for our services continues to grow. We continue to expand. Just this past week alone, we announced, some new contract signings. And so there's been real good momentum in the number of organizations that have been seeking out what we're doing, and that demand for driving, the way we're offering these services.
Lastly, Nick, here, we've seen from CMS and from private payers some reluctance, obviously, to pay for some home care like Landmark's doing over the years. If you look at what you've been able to accomplish during the past 4 months during the pandemic, what kind of lessons do you take forward as you start to try to push even further with private payers and the CMS?
So I don't know if, Matt, you're familiar with the direct contracting initiative that CMS launched.
Yep.
We just found out, I guess, about a week and a half ago that our application was accepted. So that's one of the areas we've looked at very seriously. I alluded to earlier the patient population that we serve, we see expanding. We're looking at primary care a little sort of wider than what we have in the past. So you can see that, and I'm careful on how I frame this, because I don't want it to sound like we've taken advantage of COVID. I think COVID has really just put a spotlight on what it is we do and why we do it and the need for it. It's funny, as I was thinking back, this is almost like Back to the Future, right? It's being able to do those house calls and leveraging the technology available to us. And technology, by the way, not just telehealth. I've mentioned it. Our data scientists and looking at predictive analytics and even just logistical software. How do we make sure the provider is showing up on time and we're making sure we're getting to the patients when we need them? This is a very intricate set of different solutions that we've had to put into place to make sure that we can do this as well as we do and we get there at the right time. So from a lessons learned perspective, couldn't be more proud of this team. One, we pivoted real quick. Two, making sure those patients knew we had our arms around them, either virtually or in person, making sure that they, followed what we said. We kept them safe. We're keeping them healthy. We keep them out of the hospital system. So, how do we better leverage technology? We're going to continue to learn on how to do that, and how do we better leverage our resources and get out to more patients is a constant learning for us on how we optimize what we do.
Right. Well, Nick, we appreciate you taking some time today to talk to us. We'd love to stay in touch, especially on the direct contracting model as that rolls out over the next couple of years. So, again, thanks for taking time, and we'll be in touch soon.
Thank you, Matt. Thanks for everything you do as well, and appreciate the time.
Thank you. And I'm Matthew Weinstock with Modern Healthcare. Thanks for tuning into the CheckUp. Be sure to come back next Monday, July 13th, for our next edition.